In this video, I'm going to explain everything you need to know about Wegovy, especially what it does to the body and about specific side effects. This is especially important if you're about to start Wegovy or you're already established on it. I'm also going to answer some frequently asked questions in my clinics. How long until I lose weight on Wegovy? Does it cause hair loss? And what's the difference between Rybelsus, Ozempic and Wegovy? These are really important questions that I will answer at the end, so be sure to stay tuned. And so this video will help you to understand more about this medicine and allow you to make an informed decision about taking it. So let's get started. So what is Wegovy? It's an anti-obesity injection used for weight loss, and in March 2024, the FDA also approved its use for reducing the risk of serious heart problems like heart attacks or strokes, specifically in adults with obesity or who are overweight. Its generic name or chemical name is semaglutide, and its brand name is Wegovy. It's a prescription medicine given as an injection under the skin once a week. So how does Wegovy work? Wegovy belongs to the class of drugs called GLP-1 receptor agonists that are a manufactured version of GLP-1, a natural occurring hormone in the body that acts in several areas of the brain to regulate food intake. When Wegovy is administered, it activates the GLP-1 receptors in the brain. This lowers appetite, reduces the calories consumed, and leads to weight loss. So who can take Wegovy? It has been approved for people 12 years and older for chronic weight management when used together with a reduced calorie diet and increased physical activity. So specifically, this would be adults who are obese with a body mass index of 30 or more, or overweight with a body mass index of 27 or more, and also have medical problems such as high blood pressure, type 2 diabetes, or high cholesterol as a result of the increased weight. Now, for the purposes of this video, I will be focusing on adults, even though Wegovy can be used by pediatric patients, that's 12 years and older, who are obese. So who may not be able to take Wegovy? Now, tell your doctor if you have ever had an allergic reaction to semaglutide or any other medicine, a stomach or intestinal disorder, if you have or have had problems with your pancreas, or if you have any kidney disease, if you have type 2 diabetes and a history of eye problems caused by diabetes, if you have or have had depression or suicidal thoughts or other mental health issues. If you are pregnant or plan to become pregnant, Wegovy may harm your unborn baby. You should stop Wegovy 2 months before you plan to become pregnant. If you are breastfeeding or plan to breastfeed, or if you have tumors in your glands called multiple endocrine neoplasia type 2, or if you have a personal or family history of medullary thyroid carcinoma, which is a type of thyroid cancer, or if you have a risk of diabetic ketoacidosis. So how and when do you take it? Wegovy is injected under the skin of your stomach, thigh, or upper arm using a pen device. You should not inject this medicine into a muscle or a vein. This medicine should be used one time each week on the same day each week at any time of the day. You can take Wegovy with or without food. Wegovy is available in 0.25, 0.5, 1, 1.7 and 2.4 milligram pen. The dose starts low and increases gradually to reduce the risk of gastrointestinal side effects. Now, this diagram shows the Wegovy dose escalation schedule, which you can pause and study if you want to know more. So what are the common side effects? These may include nausea, vomiting, stomach pain, loss of appetite, diarrhea, constipation, upset stomach, heartburn, burping, gas, bloating, stomach flu symptoms, headache, dizziness, tiredness, runny nose or sore throat, and a low blood sugar in people with type 2 diabetes. So what are the serious side effects? You should call your doctor at once if you have symptoms such as vision changes, especially in patients with type 2 diabetes. If you have depression or thoughts of suicide, so pay attention to any mental changes, especially sudden changes in your mood, behaviors, thoughts or feelings. Increased heart rate or fluttering in your chest, such as feelings that your heart is racing or pounding and it lasts for several minutes. If you feel lightheaded or you feel like you might pass out. If there's signs of a thyroid tumor such as swelling or a lump in your neck, trouble swallowing, a hoarse voice or feeling short of breath. Symptoms of pancreatitis, which might be a severe pain in your upper stomach that won't go away. With or without vomiting, you may feel the pain spreading to your back. If you have gallbladder problems, including gallstones, such as upper stomach pain, fever, clay-colored stools, jaundice, which would be yellowing of the skin or eyes. If you have increased risk of low blood sugar called hypoglycemia, in patients with type 2 diabetes, especially those who take medicines for their diabetes such as sulfonylureas or insulin. If you have kidney problems, which include swelling, urinating less, feeling tired or short of breath. And in people who already have kidney problems, do remember that diarrhea, nausea and vomiting may cause a loss of fluids called dehydration, which may cause kidney problems to get worse. It is important for you to drink fluids to help reduce your chance of dehydration. If you have stomach flu symptoms such as stomach cramps, vomiting, loss of appetite, diarrhea which may be watery or bloody, and if you have a severe allergic reaction. Now, these are not all the side effects from Wegovy. For a full list, see the leaflet inside your medicines packet. Now, I would also encourage you to tell your healthcare provider about all the other medicines you take if you do start Wegovy, including prescription medicines and over-the-counter medicines, vitamins and herbal supplements. This is because Wegovy may affect the way some medicines work because it slows down stomach emptying, which can affect medicines that need to pass through the stomach quickly. So now I'm going to answer some frequently asked questions in my clinic. How long until I lose weight on Wegovy? Wegovy takes time to work, but you may see some weight loss in the first 4 weeks of treatment. Doses are slowly increased when you first start treatment to help reduce side effects. It typically takes 17 weeks to reach the full maintenance dose of Wegovy, which is 2.4 milligrams, based on how well you tolerate the medicine. Here is a results table that shows how much weight adults lost in the 68-week studies. Another question I'm asked is, can you get hair loss? Wegovy and other products containing semaglutide are constantly in the news with headlines that include reports of hair loss. Remember, every individual reacts differently to medicines, so not everyone will experience hair loss. Now, saying that, hair loss has been reported after rapid weight loss, but it doesn't appear to be a common or permanent side effect. Experts think hair loss with semaglutide may occur due to a medical condition known as telogen effluvium, and it's not a direct effect of the medicine itself, although more research is needed. It occurs due to the disruption of the normal hair follicle growth cycle. There is a lack of long-term safety data available. As these drugs are fairly new, they've not been on the market for very long. The FDA, the US Medicines Watchdog, and the MHRA, the UK's Medicines Watchdog, monitor the safety of drugs throughout their life cycle. And if newly identified safety signals are identified and reported, these are then investigated. So I would encourage you to report any side effects you experience to your healthcare provider as these may be potentially caused by your medication. And lastly, I am asked, what's the difference between Rybelsus, Ozempic and Wegovy? Now, Wegovy contains semaglutide, which is the same active ingredient in Ozempic and Rybelsus. Therefore, these products should not be used together. The Ozempic injection and the Rybelsus tablet are both licensed for type 2 diabetes. Ozempic is an injection taken once a week and can go to higher doses compared to the Rybelsus tablet, which is taken every day with strict instructions. I have videos if you'd like to learn more, which I will leave a link for down below. And as discussed earlier, Wegovy is an injection licensed for weight loss and reducing heart attacks and strokes in people who are overweight and is taken once a week. So all three medicines contain the same active ingredient, semaglutide, however all have different strengths and dosages for the indication they are being used for. And as of posting this video, Novo Nordisk, the manufacturers of Rybelsus tablet, are in phase 3 clinical trial stages to see if it can help with weight loss. There's also breaking news that Novo Nordisk are testing whether the active ingredient semaglutide can help people drink less alcohol and whether it can also treat alcoholic liver disease. Now, if you've enjoyed this video, please remember to hit the like button and hit the subscribe button if you'd like to see new videos that are posted every week. And hit the notification bell if you want to get notified about new videos, and please make a comment in the comment section to tell me what you enjoyed about this video or what topics you'd like to learn more about. You can also check out my other videos and playlist.